I'm Julia Dixon. I'm faculty here at the Global Emergency Care Initiative, or GECI as we like to call ourselves for short. We get asked a lot of questions about who we are and what we do, so we thought we'd put together this quick video to introduce ourselves, tell you what we're working on, and what makes us excited about global health. I serve as the education lead within GECI. I coordinate our global health primer and accelerator courses, which are designed for healthcare providers who are interested in volunteering abroad or who have volunteered abroad and wish to expand their skill sets. My work currently includes research and training with healthcare providers in South Africa and Zambia. One of the courses I teach is the WHO Basic Emergency Care course. I particularly love seeing that aha moment on participants' faces when they put together the knowledge and skills and apply it to their clinical work in the hospital. It's particularly rewarding to me to know that this material that we're teaching is going to have a long-term impact on patients going forward. I'm going to let the rest of the faculty introduce themselves.
Hi, I'm Emily Cavallo-Hines. I'm the lead for the Global Emergency Care Initiative. My current global health work focuses mainly in sub-Saharan Africa, and I've been working for the last 15 years around issues with building emergency care systems in conjunction with national ministries of health. I think one of my favorite things about global health, after many years of doing this, is the connection that we make with others in the field, especially healthcare providers who are really trying to achieve the same ends that we're focused on. I love being focused around bringing good outcomes to the patients that we're caring for, no matter what the setting is.
Hi, my name is Nikofi Molde-Melman. I'm an associate professor of emergency medicine. I'm also a federally funded physician investigator. My areas of research are pre-hospital, trauma and resuscitation, primarily in lower and middle income countries in sub-Saharan Africa. I've had the pleasure of working in Ghana, in Kenya, in Ethiopia, and one of my longest standing research sites and platforms is in the Western Cape province of South Africa, where I do both pre-hospital and in-hospital trauma care research. I enjoy what I do a lot. I think one of the cool parts of global health research is the reciprocity, specifically the learning that happens from exchanging ideas and collaborative work between the lower and higher income settings. I think the lower income settings stand to benefit from obvious things like, research and education and capacity building, but the higher income settings also stand to benefit by learning adaptations and innovations from lower income settings, frankly, that yield similar patient outcomes to higher income settings. And I think it's cool learning for those of us who do global health and those of us in academia. So that's just one reason I really enjoy what I do.
Sure, my name is Corey Bills. I work at the University of Colorado, University Hospital, and I am the Program Director, Fellowship Director in Global Emergency Care and Public Health. So I work on a number of different projects, from educational projects that support emergency care learning in the US, as well as the support of the development of educational programs in Uganda with Makerere University, and the development of emergency care residency program, as well as in-hospital performance improvement projects in Liberia at Redemption Hospital in Monrovia. One of the things that I like best about global health is just the opportunity to learn over and over again. So each place that we go, the ability to meet with new people who are thinking about new ways of instituting emergency care, or thinking about ways of developing programs that support emergency care in those countries. And it challenges me to think about how I provide care in the US as well.
So my name is Jennifer Whitfield. I'm an associate professor. I work at Denver Health, and until recently, I ran the Global Health Fellowship, and I'm now pivoting into policy and health disparities work. What I love about global health is that global health is essentially about health equities. It allows us to address what I think is the true crux of health, which is that this tacit belief that some lives are worth more than others. And I think global health is the best and most rewarding way to address that problem. Currently, I am working on addressing how we can keep global health faculty and people engaged in global health issues and health equity issues while also having families and working clinically. I think I'm really interested in understanding what we can do here domestically to address health disparities and that have corollaries or complement the work that we do abroad.
Hi, my name is David Richards. I'm one of the faculty in the GECI group here. I'm a full-time emergency physician at the University of Colorado. My role in the GECI group is more clinical in nature, and most of my work has been in South Africa over the last 18 years. Basically, the first group of emergency medicine residents in South Africa graduated in 2006, just as I did from residency, and our careers have grown in parallel. Most of my time has been clinical there, and the way we've set this up is that the South Africans come up with clinical questions that they would like to have answered. We can use some of our staff and resources to help answer that question for them. One of the projects we worked on was pediatric resuscitations, where they felt like they didn't have the training or resources to deal with them adequately. We studied it, published a couple of papers off of it, and we were able to prove to the government that changes needed to be made, and those changes have been made with an improvement in outcomes since then. That's a perfect example, I think, of how you can responsibly and ethically do clinical care in a resource-limited setting. Personally, I find one of the most rewarding aspects of global health work is working within the clinical environment, but setting up research and protocols and things like that that affect and improve patient care. And I hear about it later when we've all left and we hear about some change in outcome that was a result of the work we did collaboratively with the South Africans. And that's what keeps me going, and I look forward to whatever projects we work on in the future. And I am very thankful for all the time that I've had spent with those guys in South Africa and the relationships we have already in place and the future to come.
We can always be reached at geci@ucdenver.edu. Don't forget to check out our website to learn more about us as faculty, projects that we're working on, and for our future course offerings.